The topic is acute glomerulonephritis. Let's review the normal nephron. The nephron is the functional cell of the kidney, and we have over 1 million nephrons in every kidney. The primary job of the nephron is to remove waste products in both the processing and the filtering function. Let's review the glomerulus. The glomerulus is located at the beginning of every nephron, and remember, we have over 1 million nephrons per kidney. The glomerulus is the main filtering agent of the kidney. You can see by our illustration that the glomerulus is made up of loops of capillaries. This requires adequate blood flow to bring those waste products into the kidney so that we can determine what is essential, what is waste product, and then move it through the system. We can calculate the rate of filtration. How quickly are these products moving through the glomerulus? This is known as the estimated glomerular filtration rate. This is a serum blood test. Now let's focus on what actually is acute glomerulonephritis. When we think of glomerulonephritis, think of the end part of that word, itis. That means inflammation. There is a direct inflammation and destruction of the glomerulus. Those loops of capillaries become scarred or sclerosed. As a result of this, we begin to lose kidney function. The more glomeruli that are damaged, the worse the kidney function is. In most cases, acute glomerulonephritis is caused by an immune-mediated condition. Our most common causes of acute glomerulonephritis consist of strep infections, primarily of the throat, and also clients who have systemic lupus. With strep infections being the most common cause of glomerulonephritis, let's focus on that. Strep infections are most commonly associated with throat infections or tonsillitis. We may also see it with skin infections. Strep infections are most common in our school-aged children. So one may wonder, how in the world does a strep infection that's in the throat find its way all the way to the kidney and cause this kind of damage? Let's take a look at that more in depth. When we have an infection, such as a strep infection, this then creates an antigen-antibody complex. Now, what happens in acute glomerulonephritis is this complex now travels to the kidney specifically, and it lodges itself in the glomerulus. And by lodging itself in the glomerulus, it is now embedding itself in those capillary walls and membranes. This then leads to damage and increased permeability of that basement membrane. Ultimately, your GFR will begin to decrease, your kidney function will decline, and the client will begin to retain fluid as well as electrolytes and waste products. This illustration demonstrates to you what we just summarized on the previous slide. When looking at this illustration, the green objects on the picture depict for us what that antigen-antibody complex looks like. As you can see in this particular picture, this is one glomerulus. Now imagine this is affecting hundreds, if not thousands, of glomeruli within the kidney. Once that antigen-antibody complex connects itself to that basement membrane of the capillary walls, it causes damage. This will now cause leaking and increased permeability. We don't want that in our kidneys because, as you can see in our picture, we now have red blood cells and protein leaking through that filtering process, which now will end up in the urine. That's not a normal place for red blood cells or protein to be. When we think about clinical features or what will the nurse assess for, we will see signs of oliguria. Remember, this means low urine output. There will be changes in the urine consistency and color. It will now become rust-colored or dark, meaning the presence of red blood cells are evident. We may also see signs of proteinuria. In addition, the nurse may be assessing the client for signs of edema, in particular periorbital edema. Why periorbital? That means around the eyes. Think about the skin that's around your eyes. It's very saggy and baggy, and it also is thin. This is a great place for fluid to migrate. In addition to that periorbital edema, there may be evidence of peripheral edema, meaning the nurse may see anywhere from +1 to +3 types of generalized edema. Because of the fluid retention, the nurse may also see signs of increasing blood pressure, evidence of hypertension. We will also see weight gain associated with that fluid retention. And overall, the client just doesn't feel well. They're going to have flu-like symptoms. What will our diagnostics provide for us? A basic urinalysis will tell us a lot. There'll be presence of red blood cells as well as presence of protein. We're going to see our standard renal tests such as BUN and creatinine will be grossly elevated. We will see evidence of a recent streptococcal infection, either a positive blood antigen test or a positive throat culture. In regards to the medical management, there really is no specific treatment for post-streptococcal glomerulonephritis. Most children will recover spontaneously and uneventfully. However, there are some complications that the nurse must be monitoring for. One being hypertensive encephalopathy. Again, remember with that fluid retention, one of the places it could go is into the brain. We may see signs of increased intracranial pressure due to that hypertensive state. We could see signs of headache, nausea, vomiting, and even seizures. If there is a change in level of consciousness, we should alert the healthcare provider immediately. We may also be monitoring for acute kidney injury. Remember from our previous slides, the picture illustrating the damage done to the glomerular basement wall. This could lead to acute kidney injury, so be monitoring closely for that. We want to be monitoring for fluid overload. Examples of this may be systemically. When we're listening to lung sounds, the nurse may be hearing the presence of rales. In addition, we may be monitoring for edema as well as weight gain. Evidence of pulmonary edema would be present by a productive, frothy cough. Most clients require just supportive care. We may be implementing antihypertensive agents, especially if that client is demonstrating hypertension. If the client's kidneys are still working effectively, we will implement the use of diuretics. This will allow us to assist in the process of eliminating that extra fluid that is in the body. For some cases, as it is rare, temporary dialysis may be required. This would be in the form of hemodialysis. When the kidneys are not functioning properly, as we've noted, there will be retention of fluid. There's also going to be retention of waste products and electrolytes. Sodium in particular will be retained. And remember, wherever sodium is present, water will follow. So we will implement a sodium-restricted diet for the client temporarily. We will also implement fluid restrictions, monitoring those vital signs for changes such as the increase in blood pressure, increase in heart rate. Vigilant intake and output documentation must be done. We need to know how much has gone in, how much is coming out. This is also in relationship to those daily weights. Using the same scale every day is important because some scales can differ. And as we've noted before, every ounce matters. Monitor for neurological changes that may be occurring due to fluid retention in the brain. So report any onset of headaches. Monitoring for seizures will also be indicated. And lastly, and very importantly, make sure that we are administering those antibiotics if indeed this is due to a strep infection. Any future strep infections must be treated accordingly because this could lead to further damage of that glomerular membrane wall.